The head of the CDC is again emphasizing the, quote, power of vaccination. Citing the findings of a new study, Dr. Rochelle Walensky says unvaccinated individuals are at greater risk of coronavirus infections, hospitalizations, and death. She added that with vaccines, the U.S. has the tools to, quote, turn the corner on the pandemic. But the pace of first-dose shots has fallen for 7 consecutive days, with the daily average dropping to nearly 340,000. And less than 63% of the population is at least partially vaccinated. Dr. Ali Raja joins me now. He's a professor at Harvard Medical School. Dr. Raja, thanks for being here. So the head of the CDC says that unvaccinated individuals are 4.5 times more likely to contract the virus, over 10 times more likely to be hospitalized, and 11 times more likely to die from COVID. So why is it still proving so hard to get the unvaccinated protected?
Lana, that's the key question. We've had so much data demonstrating similar findings over the past few months, but these are exceptionally compelling because now we're talking about, even in the face of Delta, right now unvaccinated Americans are at such higher risk. The patients that I'm admitting to the hospital, the vast majority of them are unvaccinated, and they're otherwise young and healthy people. I don't know what else it's going to take, but we're going to keep advocating as much as we can, the doctors, the nurses out there, to get people vaccinated.
It's really concerning that what you're seeing are otherwise healthy individuals now being affected by this. Well, President Biden certainly thinks that part of the way that we get more Americans vaccinated is by announcing these sweeping vaccine mandates. Several businesses and many universities have already issued their own requirements, and some experts say that these mandates could turn the tide on the pandemic. But they caution that it won't happen immediately. What are your thoughts on this?
Lana, I wish that it didn't take a vaccine mandate to do this, right? I wish that data like that we just talked about and all of the experience that we've had over the past 6 to 12 months would convince people to get convince people to get vaccinated. But the fact is that this is likely what it's going to take. Like you said, a number of hospitals, my hospital, a number of big companies, Google, for example, universities across the country, they're mandating vaccinations. But for so many big businesses, they're not mandating vaccines, at least for their frontline employees. And many of them have corporate mandates. But if this is what it takes to get otherwise unvaccinated people vaccinated, we need to do it.
President Biden also told parents Friday, quote, the safest thing that you could do for your child 12 and over is to get them vaccinated. Are you still seeing resistance from parents? And if so, what's at the root of it?
I am. You know, when you look at the data around the country, Lana, the 12 to 15-year-old age group is the least vaccinated in the country. Only about a quarter of them are fully vaccinated. And in the vast majority of states, I think there's only 16 states in the country that allow for teenagers to make their own medical decisions like that. So for the vast majority of the states, that's going to take convincing their parents, not the kids directly. And that's where we need to focus, is talking about the fact that we are seeing kids hospitalized. I think there was earlier this week, there was 240,000 kids who had tested positive and 2,400 kids hospitalized around the U.S. And that's what we need to tell parents so that they can get their teenagers the vaccines.
You know, Dr. Raja, there are many parents, myself included, that expected that a pediatric vaccine for younger children would be available by now. And it seems that there are some parents who are overwaiting for it. In fact, the FDA has issued a warning that children are, quote, not small adults, and that kids under 12 should not be vaccinated with adult vaccines, stating, quote, because young children are still growing and developing, it's critical that thorough and robust clinical trials of adequate size are completed. Tell us, what is the holdup on a pediatric vaccine, and where are we in that process now?
Lana, you and I are in the same boat. I've got a 9-year-old and a 7-year-old, and I wish they were vaccinated. But the fact is that until we have data about vaccine safety in those younger children, we shouldn't get them vaccinated. And I know that there are parents out there of 10 and 11-year-olds who are considering perhaps not following the protocols and getting them vaccinated. But the fact is that we need to have data in that age group. Fortunately, it should be coming soon. We should hopefully have some data from at least the Moderna trial within the next month or so, and hopefully the Pfizer trial soon after that. So it's coming, but I think not as soon as any of us might want.
Sure. And the message then to parents who believe in the vaccine, who believe in science, is wait for the science. Don't buck what we're being told by the FDA in an effort to get your children protected, unnecessarily taking risks. So in the meantime, though, kids are back in school. There have already been several closures due to outbreaks. Dr. Raja, do you think that it's still possible to safely continue in-person learning? Do you expect to see more school closures, particularly in elementary schools where kids don't have the option of vaccination yet?
I do. I expect to see some school closures. My kids both got tested in a sort of a pooled testing program this week, and I know that's going to happen every week in their school and in schools around the country. But quite honestly, we need to make sure that our schools have the capability to keep that testing going. In the last segment, you were talking about making sure that the schools have enough testing kits and enough supplies and enough personnel, and we have to do that, or else we're going to end up with kids who deal with the same uncertain school year that we had last year and the year before. We need to keep schools open, and that's going to mean keeping kids tested and sending kids who test positive home as soon as possible.
All right. Dr. Ali Raja, thank you for being on the show, and thank you for all that you do.
Thanks, Lana.